Benign prostatic hyperplasia, or BPH, refers to a non-cancerous enlargement of the prostate gland in men. The prostate has two distinct phases of development as a man ages. The first is the enlargement of the prostate during the first years of adolescence. The second stage of growth starts at the age of about 25 and lasts for the majority of a man's lifetime. The second stage of development is frequently accompanied by benign prostatic hyperplasia. The urethra is compressed and squeezed by the enlarging prostate. The lining of the bladder thickens. As the bladder ages, it may lose its strength and not be able to expel all of the urine. Frequent urination and pain in the pelvic, abdominal, and scrotal, male private area, regions may be signs of incomplete bladder emptying. A little gland called the prostate is a component of the male reproductive system. Men's reproduction relies on the fluid in their prostates. The urethra is located near the bladder's neck, which is surrounded by the gland. The bladder neck is where the urethra connects with the bladder. Lower urinary tract components include the bladder and urethra. The prostate, which have two or more lobes enclosed by an outer layer of tissue, sits in front of the rectum and just below the bladder. The urethra is the conduit through which urine is expelled from the urinary bladder. In men, semen is expelled from the penis via the urethra. When the prostate swells or enlarges, it presses on the tubes that lead from the bladder to the urethra, causing urinary incontinence. Signals that your prostate is growing. 1. You go to the bathroom over 8 times a day. 2. The inability to hold your urine for more than a few minutes. 3. Difficulty initiating urination. You may be experiencing a weak urine stream that intermittently stops and starts. 4. Pain after ejaculation or during urination. 5. Urine with an odd hue or odor. 6. Having trouble urinating. An obstruction in an individual's urinary tract may go undetected until he is unable to urinate. Acute urine retention is a side effect of several congestion relievers included in over-the-counter colds and allergy drugs, including pseudoephedrine and oxymetazoline. These drugs may cause the bladder neck to tighten, making it difficult to empty the bladder. Antihistamines, including diphenhydramine, can reduce the strength of the muscles of the bladder, leading to urine retention, trouble urinating, and even discomfort when peeing. Consuming alcohol, being exposed to cold temperatures, or sitting for an extended amount of time can all cause urine retention. In males with a partial blockage of the urethra, the following increases a man's risk for benign prostatic hyperplasia: erectile dysfunction, being over the age of 40, having a history of benign prostatic hyperplasia in one's family, being overweight, having heart or circulatory illness, or having type 2 diabetes, not getting enough exercise. An enlarged and swollen prostate, if untreated, can increase the risk of prostatitis, infections, and even prostate cancer. Hormone studies reveal that an excess of anabolic hormones like estrogen, insulin, or DHT is to blame for prostate growth. Testosterone, a male hormone, and a small amount of estrogen, a female hormone, are both produced by men. The amount of active testosterone in men's blood declines as they age, resulting in a higher proportion of estrogen. According to scientific evidence, benign prostatic hyperplasia may arise because a higher proportion of estrogen within the prostate boosts the activity of chemicals that encourage prostate cell proliferation. Dihydrotestosterone, DHT, a hormone found in men, is the subject of one theory because of its potential function in prostate growth and development. Evidence suggests that as men age, their prostates continue to manufacture and store a large amount of DHT despite a corresponding decrease in blood testosterone levels. This buildup of DHT may stimulate the expansion of prostate cells. Researchers have found that males who do not make DHT are protected from BPH. In this video, we'll discuss 6 vitamins and supplements that have been shown to reduce the growth of an enlarged prostate and increase urine flow. In addition, you'll find out how to address the problem from its foundation by making some basic adjustments to your way of life. These supplements contain phytonutrients, minerals, and herbs that can be used to achieve a natural reduction in prostate size. If you have any medical concerns, please consult a physician. Number 1. Stinging nettle. The hairs on these leaves can cause severe pain, itching, redness, and swelling if they come in contact with the skin. After being processed into a supplement, dried, freeze-dried, or cooked, stinging nettle can be safely ingested. Several potential health benefits have been suggested by the studies. Across Europe, nettle root is frequently employed for the treatment of benign prostatic hyperplasia, BPH. Urinary urgency, nocturia, the frequent need to urinate at night, and frequency can all be alleviated by combining traditional medical care with stinging nettle, which has been shown to be beneficial in reducing their severity. Nettle can be combined with other all-natural BPH remedies like pygium or saw palmetto. Nettle has relatively small side effects, such as an upset stomach or a skin rash. Number 2. Zinc. When it comes to reducing the size of a swollen prostate and maintaining a healthy hormonal balance in men, zinc is a crucial element. Zinc helps prevent testosterone from being transformed into estrogen or dihydrotestosterone, DHT, by blocking the action of two enzymes, aromatase and reductase. Alongside reducing inflammation, this helps correct the hormonal imbalance that is responsible for your enlarged prostate. You can begin taking a daily supplement containing 30 mg of zinc chelate, zinc biglycinate, or you can get it from whole foods such pumpkin seeds, oysters, crab meat, beef, organ meats, watermelon seeds, and sugar-free dark chocolate. Note: if you take a zinc supplement, be sure to also take copper in a combination of trace minerals because too much zinc might deplete copper. Number 3. Pygium. Pygium is a herbal extract derived from the African cherry tree's bark. Since numerous studies have shown that pygium has beneficial effects, it has become a popular alternative treatment. There is some evidence that indicates that the extract can aid with inflammation, prostate health, and renal health. Studies have shown that the extract is effective at reducing pain, inflammation, incontinence, and nocturia, urinating at night. In 2012, researchers found that pygium extract inhibited the expansion of prostatic tissue. Possible protection against the onset of BPH. One of the most well-supported herbal treatments for BPH is pygium. Possible prostate cancer protection is another benefit. The same 2012 study that shown pygium's usefulness in treating BPH also showed that it inhibited the growth of malignant prostate cells. It was discovered in 2010 that pygium influences androgen receptors, the molecules that regulate prostate growth. Number 4. Phytosterols. Some plant compounds called phytosterols have been demonstrated to reduce the growth of an enlarged prostate and increase urine flow by inhibiting the hormone dihydrotestosterone, DHT. Cholesterol doesn't cling to the artery walls as much when phytosterols are present, which is good news for those concerned about developing heart disease. In addition, men utilize phytosterols to stop male pattern baldness, which is likewise brought on by an excess of DHT. Phytosterols can be found in a variety of foods, but the highest concentrations are found in pumpkin seeds, sesame oil, macadamia nuts, green peas, and extra virgin olive oil. Incorporate them into your diet frequently, especially pumpkin seeds. You can also acquire this in a supplement called saw palmetto, which is high in beta-sitosterol and works wonders to shrink the prostate. If you're enjoying this content, please give it a like, subscribe, and enable all alerts to receive my most recent advice on health and nutrition. Number 5. Lycopene is the fifth antioxidant. Tomatoes of every variety are an excellent source of the antioxidant lycopene. Carotenoids, found in red plant pigments, help shield cells from oxidative stress. Lycopene use lowers PSA levels, aids in prostate shrinkage, and lowers the risk of prostate cancer, according to studies, by balancing out testosterone levels. Age-related declines in testosterone are associated with increased estrogen and prostate enlargement. Therefore, this is especially helpful for elderly men. When tomatoes are cooked, the lycopene in them becomes 4 times more accessible. In order to maintain a healthy prostate, you should incorporate home-cooked tomatoes into your diet on a regular basis. Although lycopene supplementation is available in the form of plant chemical mixtures, getting your lycopene from food sources is much more convenient. Basil, grapefruits, goji berries, and asparagus are additional good sources of lycopene. Number 6. Saw palmetto. A type of palm native to the southeastern United States, it is often used in supplements to promote prostate health, regulate hormone levels, and prevent male hair loss. In addition to these advantages, it's also linked to things like reduced inflammation and enhanced urinary function. Saw palmetto has been linked by several studies to improved prostate health and protection against BPH and prostate cancer. Taking 320 mg of saw palmetto extract daily may slow the development of BPH, according to a 15-year research involving 30 men. There are 5 things you may do to reduce the size of your prostate through better hormone regulation and less inflammation. 1. Incorporate organic cruciferous vegetables like radish, broccoli, arugula, kale, collard greens, and cabbage into your daily diet by eating a salad. These are high in phytonutrients, which stimulate the production of antioxidants that protect and cure the prostate, and help the liver get rid of any extra hormones. 2. Include a handful of pumpkin seeds in your daily diet. They are among the best foods for reducing the symptoms of BPH. The combination of zinc, phytosterols, and vitamin E in this product effectively shrinks the prostate. 3. Swap out refined carbs for whole foods like tomatoes, organic grass-fed beef, shellfish, wild salmon, and avocados. This includes eliminating processed foods like sugar, breads, cereals, pastries, and sweets. The prostate and seminal fluid will benefit from the characteristics found in all of these foods. Rather than using margarine, soy, canola, cottonseed, or corn oils in your cooking, switch to raw coconut oil or extra virgin olive oil, both of which are low in omega-6 fatty acids and high in monounsaturated fatty acids, which help reduce inflammation. You should also stay away from milk and cheese because they might make an enlarged prostate even worse. 5. Begin training with intense intervals. The anabolic chemicals testosterone, dihydrotestosterone, DHT, estrogen, and insulin can all be decreased by doing HIIT just twice a week for 10 minutes each. Exercise also aids in burning extra blood sugar, which may be a factor in the prostate's inflammatory state. The time for this video to conclude has come. If you find this video interesting and you haven't subscribed to our channel yet, what are you waiting for? Don't forget to leave a like, a subscribe, a share, and a notification for future updates.